Thank you very much for that wonderful music performance. That was Auguste Rahon. He's actually a student at the Haute École de Musique de Genève. So if you're interested in his work, you can find him there. Thank you so much for putting us at ease and relaxed after what has surely been a very jam-packed and filled day already for the first day of the Geneva Health Forum, and I'm sure that eases us nicely into the cocktail section part of the event, which is going to be coming right after this opening ceremony. And with that, I don't want to waste any time. I want to jump right into that. I would first like to welcome Véronique Maévuta, who's the co-president of the Geneva Health Forum and director of external affairs at Geneva University Hospitals. She's going to be joined by Antoine Geisbühler, welcome back, co-president of the Geneva Health Forum and vice rector of the University of Geneva. And I will give them the floor now to deliver the welcome message. Thank you very much.
Merci. Excellence.
Excellencies, Madam Director General of the United Nations Office in Geneva, Mr. Representative to the United Nations and other international organizations here in Geneva, Mr. President of the International Committee of the Red Cross, Madam Director General of the World Health Organization for Animal Health, Mr. Vice President of the Council of State, Madam Director General to the World Health Organization, Mr. Director General of the Geneva University Hospitals, ladies and gentlemen.
Committee, please let me welcome you all here in Geneva and those of you who are online to this 9th edition of the Geneva Health Forum. This forum has been designed by a large group of experts and stakeholders in the domain of global health, here in Geneva, in Switzerland, and internationally, aiming to bring together practitioners, professionals, academics, innovators, donors, policymakers, representatives from governments, from international organizations, and from non-governmental organizations in order to exchange, learn from each other, and discuss current issues related to global health. I want to take this opportunity to acknowledge and warmly thank the members of the Forum's Program Committee for their invaluable input and guidance in these challenging times. Indeed, the COVID pandemics and the environmental and climatic emergencies have highlighted how little we know and how difficult it is to make appropriate decisions when having to take into account not just human health, but also animal health, the environment we live in, and most importantly, the hard limits for the sustainability of our only planet. I am convinced that the various activities and events during this forum will give us all a better understanding of how to evolve in our practices of global health, in the way we learn, teach, do research, innovate, implement solutions, gather evidence, and share knowledge. I also hope that this forum's community will remain active as it has been between these big gatherings and will continue to contribute to strengthening global health and help address some of the major challenges of our times. I wish you all an inspiring, productive, and enjoyable meeting. Thank you. And now over to you, Véronique.
Les salutations protocolaires ayant été...
The protocol of greetings having been ensured, I can wish you all a very warm welcome for this 9th edition of the Geneva Health Forum. Since 2006, the Geneva Health Forum has brought together every 2 years the key players in finding solutions for the future of global health in the framework not only of improvement of health, but also of access to medical care. Thanks to a multidisciplinary approach as well as the capacity of providing innovative solutions, the Geneva Health Forum takes into account the complexity of growing challenges and has become one of the key international conferences in the field of global health. This year, the event will be dealing with global health and global changes. The COVID-19 pandemic, which is not entirely solved, and the environmental damage, let us foresee future crises. These new challenges which question our concepts and our practices as well as the thought for one single health, as well as the communities becoming full players for their health and that of their environment. The Geneva Health Forum will deal with these issues during these 3 days, opening the door to innovative innovations and producing suggested solutions. I wish you a very good Geneva Health Forum 2022, rich in inspiration.
Big thank you to Véronique May. I'd now like Antoine Geisbiller to stay on stage and in your role as Vice Rector of the University of Geneva to deliver a word of support to the Geneva Health Forum.
Thank you very much. That will be my last intervention. Excellencies, ladies and gentlemen, as Vice Rector of the University of Geneva and on behalf of our Rector, I would like to share a few thoughts about the place of academia and of our university in a rich global health ecosystem such as the one we have in Geneva. One of the key roles of a university is to help grow responsible citizens able to contribute to our society and to a world facing multiple global issues. Global health, as other global issues, is intrinsically complex and intertwined with many other domains. Disciplinary approaches that have historically structured universities are no longer sufficient to address global issues, and interdisciplinarity must be fostered, organized, learned, and experienced in order to produce relevant new scientific knowledge. But the creation and transmission of knowledge is not enough. It needs to be turned into action, implemented for real, and able to produce measurable results. Universities must therefore evolve in the way they teach. They should promote project-based learning, develop soft skills, foster innovation, facilitate translation, encourage entrepreneurship, and better connect with those who are active in the field. Innovation should not be viewed only as technological, but must include social and organizational approaches, as well as reverse innovation and frugal innovation. Universities should also further their ability to generate scientific knowledge in complex real-world situations and help guide the development of sound, evidence-based policies. Given its unique proximity with international and non-governmental organizations active in the domain of health and humanitarian action in Geneva, our university already contributes to initiatives that can leverage such synergies. For example, the Geneva Science and Policy Interface works with the International Geneva on facilitating science-informed policy making. A university chair in computational diplomacy has recently been created in order to contribute to the development of a new domain of knowledge which combines computational sciences and diplomacy. The Geneva Hub for Global Digital Health aims at bringing the learnings from implementation and evaluation sciences to decision makers, policy makers, donors, and implementers active in the promising but volatile and fragmented domain of digital health. In this rich context, the Geneva Health Forum plays an essential role in order to help academia better understand its role and added value in dealing with global issues. And at the same time, it gives the opportunity to universities to showcase their contributions to science, to innovation, and to the dissemination of knowledge. The Forum's Global Health Lab, showcased on the first floor of this building, provides many such inspiring highlights. I thank you for your attention and really look forward to many cross-fertilization opportunities in the days to come and wish all of us an exciting new edition of the Geneva Health Forum. Thank you very much.
Thank you. Now, to continue the word of support to the Geneva Health Forum, I now like to welcome Bertrand Levrat, Director General of Geneva University Hospitals, to the stage.
Mesdames, Messieurs, Excellences, chers amis.
Ladies and gentlemen, Excellencies, welcome to Geneva for this Geneva Health Forum edition. It's an honor and a pleasure to welcome you here. We see you as numerous, and we're very proud and happy to be able to meet all together after these some 2.5 years, each separated behind a screen, of being able to meet in person. This forum, the Geneva Health Forum, was created in 2006 on the initiative of the Geneva University Hospital and Geneva University, in partnership with some 30 global health organizations, with the aim of contributing to the improvement of health and access to health. Since its creation, the Geneva Health Forum has developed in 4 key ideas. The first, of establishing a critical and constructive dialogue between the global health players coming from various sectors, with organizations, social and public authorities, practitioners, and the private sector. The second is the witness of those working in the field to develop health policies in line with the realities. Third principle, we're looking attentively at the countries with limited income and the humanitarian context. And fourth, of being assured of the dynamism of international Geneva in the field of health. 16 years later, the world has changed quite clearly, but we have also adapted. Climate change has come on our agenda, and it's now important to speak of it today. There's a pandemic which has completely changed our lives and changed our structures and organizations. And in 16 years, the Geneva Health Forum was able to develop partnerships with a number of other organizations, such as key players, such as the Development Director and Swiss Confederation, the World Health Organization, WHO, the ICRC, and the academic institutions and international organizations here in Geneva, and many other players. I would like to thank you all very warmly for your essential endorsement to the Geneva Health Forum. This 9th edition shows us to what extent it's important in a world which is more polarized and which is seeking more division than regrouping, the importance of meeting together to exchange our experiences, our visions, and our practice together.
English is that there are no foreigners, only new friends to meet. So I wish you all to meet new friends here in Geneva, because we are not only proud to be an international city, but also a city with a Geneva spirit. This spirit is making you all feel comfortable here in Geneva, but to make you all feel in the Geneva Health Forum the capacity to innovate, to find new solutions, to listen to the experience of others, and to grow together for a better world. Comme directeur,
as Director General of the Geneva University Hospitals, I've just spent 2.5 years with extremely committed colleagues, confronted with a pandemic that we had unable to imagine the magnitude or the reality that was going to impact our citizens and outside of our borders, because Geneva, as you know, also welcomed numerous patients from abroad. Today, not only am I happy and proud of my teams, but I realize to what extent I've acquired experience by listening to directors and other players in other health structures. All together here in Geneva, we faced up to the situation and taking into account the limits and listening to others. We realized to what extent the hospitals and health structures have been changed by the pandemic, but we all found solutions to find approaches. I would like to express my thanks, introduction to the Geneva Health Forum, to all the health workers, as everyone has been exceptional during this COVID-19 pandemic. You gave meaning to your mission, at times endangering your own lives. I would like to thank you for your courage and to wish you all an extraordinary forum. Take advantage of this moment, which is unique, to listen, to hear, to share, and to grow together. Thank you very much, and have a very good forum.
A big thank you to Mr. Lefra for all those kind words, and I think that we really have to take that on board and take advantage of the fact that we all get to be in this auditorium together in Geneva, and as you can see, it is a packed house. We don't even have enough seats. So with that, I'm going to continue and move on. I'd now like to welcome Susanna Jacob, Deputy Director General of the World Health Organization, and she is going to be giving a declaration by WHO.
Excellencies, colleagues, ladies and gentlemen, there are many crises in the world currently, many complex emergencies, like the war in Ukraine, the climate crisis, and the persisting threat of COVID-19. All of these and more are contributing to huge spikes in food and fuel prices, as well as inflation, adding immensely to the challenge of securing healthy lives for all. The UN Secretary General, Antonio Guterres, warns that our global goal of slowing climate warming to 1.5 degrees is now on life support as we sleepwalk through climate catastrophe. A worsening climate crisis is leading to countries being affected by concurrent climatic catastrophes simultaneously. At the same time, biodiversity loss, deforestation, unsustainable intensification of livestock and agricultural production, ecosystem degradation, and pollution continue to make the climate and nature crisis the largest, the most complex existential challenges that we have ever had. Based on conservative WHO estimates, over 13 million deaths around the world every year are the result of preventable environmental factors, and over 90% of the global population breathes unhealthy air. Excellencies, colleagues, a bold transition to healthier, more sustainable and just societies aligned with the aims of the Sustainable Development Goals is now an incontrovertible imperative. Concretely, concerted action across at least 5 key areas is needed to make humanity more resilient to future health threats. First, we must begin by acknowledging that health is not negotiable. It is a central pillar of sustainable development. Health has been compartmentalized and deprioritized for too long. The pandemic has taught us that health is not a cost to be contained, but an investment to be nurtured. Second, we must shift from health systems focused purely on treating diseases to health systems focused on disease prevention and health promotion as well. We must advocate to refashion economic systems and measures of economic growth to promote holistic approaches to health promotion and protection. Third, equity is not a nice-to-have concept, but an essential prerequisite of sustainable development and health security. The vulnerability of one single nation makes the world as a whole more vulnerable to disease threats. Fourth, we must move from a fragmented global health architecture for prevention of preparedness and response to a cohesive architecture with stronger governance, financing, and tools. There is some encouraging progress in this area. At the special session of the World Health Assembly last year, WHO's 194 member states decided to negotiate a new international instrument to provide an overarching framework for pandemic prevention, preparedness, and response. Finally, we must shift from a siloed sectoral approach to human health to a multi-sectoral, interdisciplinary, and inclusive One Health approach that acknowledges and addresses the intimate links between the health of the humans, animals, and the planet that sustains all life on Earth. About 75% of emerging infectious diseases enter human populations from animal populations. At the same time, human activities, including biodiversity loss, deforestation, intensive livestock, and agricultural production that encroaches on wildlife habitats, can create opportunities for the spread of previously unknown pathogens. As a testament to our commitment to environmental stewardship and to promoting a healthy, green, and just recovery, very early in the COVID-19 pandemic, the Director General of WHO, Dr. Tedros, released the WHO Manifesto for a Healthy and Green Recovery, laying out 6 foundational pillars spanning several environmental determinants of health, the first of which centers on safeguarding the foundation of human health, which is the nature. Ushering in a new era of strengthened cooperation for One Health demands that the interconnections between people, animals, and ecosystems are understood and valued in equal measure. In this light, we welcome the recent expansion of the tripartite alliance with FAO and OIE, which now welcomes UNEP as an equal partner in an expanded quadripartite alliance for One Health, which will soon release a new joint plan of action for One Health. And I'm sure that my friend Monica Loa will also speak about this. The pandemic has revealed weaknesses in all areas of society and underlined the urgency of creating sustainable, well-being societies committed to achieving equitable health now for the future generations without breaching ecological limits. To prevent the current multidimensional crisis from turning into a death spiral for humanity, concerted and creative efforts to bend the arc of history towards a solution-oriented, healthier, and sustainable world are needed now. I thank you.
Now, we've heard time and time again how important Geneva plays a role not only for this forum, but in the state of global health. And with that, of course, it makes sense that we have a declaration from the Canton of Geneva. And I now like to welcome Mauro Poggia from Vice President of the State Council to come up and give us this declaration.
Mesdames et messieurs,
ladies and gentlemen, whether you are here with us in this room or connected online, I would like to welcome you on behalf of the Geneva state. Welcome to a canton and a cosmopolitan city open to the world capital of health, whose commitment is part of a long-standing tradition of the promotion of humanitarian values. In times of uncertainties, political instability in the whole world, these values remain essential. Global health plays a key role in Geneva with the presence of very committed international organizations and heavy investment. It enjoys the presence of sophisticated industries, state-of-the-art hospitals. We support these projects, which should be presented during this forum, including the development of the pneumoscope, whose the product of a collaboration between the Canton of Geneva, the hospitals and Polytechnic, which should allow practitioners to detect pneumonia. The Geneva Health Forum is an unavoidable event for the Canton of Geneva, and we have supported this event since its inception on the basis of a 4-year mandate. Since 2016, the Geneva Health Forum gathers eminent leaders, practitioners, international organizations, the academia, private sector, public sector, and encourages the development of innovative solutions for health. No key leader can go it alone, and therefore it is together in a concerted and coordinated manner that we will find a solution, as we have done over the past 2 years in addressing the COVID-19 pandemic. This 9th edition of the Geneva Health Forum is looking at the environmental impact on health, looking at constraints in the animal world, such as the reduction of biodiversity, the loss of fertile land, industrial growth, which can explain this pandemic's pollution, is also the cause of many diseases and death. In terms of climate change, it has led to a more difficult situation, encourages migrations, and has an impact on water resources. This forum should allow us to draw the lessons of the COVID-19 pandemic and better understand the impact of the environmental degradation on our health. Today, it has become evident that human health is closely connected to the health of our animals, and they are interconnected. This is why in 2017 we created an interdisciplinary platform called One Health, made of representatives of the Federal Office for Food and Animal Affairs, as well as various federal offices. It also calls on experts of the Army. And this collaboration, this close collaboration between human and animal medicine is crucial if we want to promote good health for humans and animals, and to allow us to address new threats that should impact our health, human and animal, as well as the environment. As a conclusion, ladies and gentlemen, we are just at the beginning by developing and consolidate tools so we can build the health of tomorrow. The Geneva Health Forum has generated growing interest at the local and international level and has become a unique forum for such gains in the past. Over the next 3 days, different experiences will meet, and I would like to take this opportunity to thank the organizers of the Geneva Health Forum, as well as all the people that were involved in organizing this meeting and who will inspire each other. I wish them a very fruitful, rich meeting and dialogue with concrete actions to build a better health in the spirit of Geneva. Thank you.
Thank you very much for that. To continue this declaration by the Canton of Geneva, I'd now like to welcome to the stage Jörg Lauber. He's the permanent representative of Switzerland to the United Nations, as well as other organizations here in Geneva. Welcome.
Merci beaucoup, mesdames et messieurs.
Thank you so much, ladies and gentlemen. It's such a pleasure for me to be here for the opening of the 9th edition of this forum, the Geneva Health Forum. Its president just mentioned it is a landmark within the international Geneva. It allows us to look at new challenges, and Geneva has a key role to play, as it is a microcosm favorable to innovations. In terms of global health, Geneva can count on the presence of state-of-the-art hospitals, institutions representative of the public and private sector. International Geneva is also host to many international organizations with key leaders as well as humanitarian organizations in other areas. This is why Geneva is a great place for innovation and mutual learning. The proximity of all these stakeholders with an open dialogue allows for the possibility to develop new tools for global health. Ladies and gentlemen, human health is connected to the health of our planet, whose health is quickly deteriorating, so we have to reinvent global health. Time is of the essence. We must work together. The stakes are too high. Global issues cannot have global solutions only. We must work at the multilateralism level to meet those new challenges, which must be transparent and inclusive, open to all stakeholders, so we can connect institutions with the expertise of various stakeholders and communities. It is in this context that I'm convinced of the role that the Geneva Health Forum can play, and I wish you a successful forum. Thank you.
Now, to continue our distinguished lineup of speakers, it's time now to welcome Tatiana Volovaya, Director General of the United Nations of Geneva. Welcome back.
Dear colleagues, dear friends, it's a real pleasure for me to join you for this opening ceremony for the 9th edition of Geneva Health Forum. And I think it's very important that we can meet together in person and in hybrid using modern technology after these very difficult years of pandemic. And of course, during the 3 days of negotiations, there will be many discussions about lessons learned from the pandemic and what we should do and could do together to avoid similar situations in the future. And when we are speaking about these lessons learned, there are many of them, but quite few are absolutely obvious. Lesson number one, we all live in a globalized world. We are all very interconnected and interdependent, and we can be as safe, as healthy as all other people around the world are. That means we have to work in solidarity. Lesson number two is also, I think, very, very clear. We can do a lot to improve the environmental degradation. Because before pandemic, United Nations were always speaking about the necessity to fight the climate change, to fight the climate crisis. But there were some voices of people who said that, well, humanity can't change the situation because we can't do anything. What we saw during the first months of the pandemic, when half of the humanity were under lockdown and stopped economic and social activities, immediately the nature responded in a very positive way. We saw less pollution, we saw better quality of air, water, we saw even biodiversity in the streets of large cities. Of course, humanity can't stop their economic and social activities, but we can do it in a sustainable way. And the humanity does have a blueprint for sustainable way of economic and social development, sustainable development goals. And that's absolutely clear that we can do it, it's achievable. Another lesson of pandemic, which also confirmed what the United States were always saying, we have to fight inequality. During pandemic, we saw that those who were very vulnerable, who were living in poor regions or poor countries, were the first to suffer. And we saw this inequality during the pandemic with the access to healthcare, to vaccine, or even to the clean water, which was necessary during the pandemic. Again, that shows the importance of Sustainable Development Goals. And also what we saw during the pandemic, and not only during pandemic, but before and now, all the challenges the humanity is facing, be it sanitary challenge or geopolitical challenge or environmental, are global challenges. And being global challenges, they need global solutions. And global solutions can be only multilateral solutions. We need multilateralism more than ever. And they need modern multilateralism fit for the 21st century. The multilateralism which is inclusive and integrated. And of course, the member states, the sovereign member states of the United Nations remain the key actors in the international arena. But they are not the only actors. We have to build for multilateral system which includes not only the member states, not only the governments, but also non-governmental organizations, private sector, academia, universities, young people, etc., etc., etc. Only together we can find solutions which will be global solutions. And from this point of view, Geneva Health Forum is exactly an example of this modern multilateralism, where professionals from the health system, professionals from academia, representatives of international organizations, of private sector, of governments, will be working together and looking for the solutions. We're absolutely sure that's the future of the multilateral system, and I'm really very happy that this future is being created, being built here in Geneva. I wish you a very good and very effective forum. Thank you.
A big thank you to Ms. Valovaya for that message to end our opening ceremony. Now we've come to the part of the ceremony where we just have 2 more keynotes before we wrap up. And for the first keynote, I'd like to welcome Monique Eloi, Director General of the World Organization for Animal Health. Welcome to the stage.
Excellencies, ladies and gentlemen, good evening.
Let me first thank the organizer for inviting me in this opening ceremony of the new edition of the Geneva Health Forum, dedicated this year to global health in times of global changes. Nice title, because it's really timely, because the COVID-19 pandemic is still ongoing, even severely in some parts of the world, while we continue to face alarming challenges such as climate change, environmental degradation, and biodiversity loss on a global scale. It's clear that we have urgently to change to a path with greater collaboration, equity, and transparency to address these challenges. One Health approach provides us with the appropriate framework to do just that, thanks to equal weight given to early detection, prevention, and risk reduction. In fact, we have to anticipate and go ahead to the challenges before they become crises. In addition, One Health approach encourages the participation of all relevant sectors and disciplines to address in a comprehensive, coordinated manner the 3 main components of the One Health, namely human health, of course, animal health, and the health of the planet. That is why I'm very pleased to inform that the tripartite partnership has now officially expanded to include the UN Environment Programme, UNEP, and that we are now stronger together through this quadripartite collaboration for One Health. But to achieve our common goals and to deliver what is expected by our members, we have to make these partnerships operational, sustainable, and streamlined in our systems. They have to be based on key principles of good governance, inclusiveness, and transparency. Obviously, the role of academia and civil society organizations that represent the main, I do think, the main participants in this forum is crucial to the One Health approach. You bring additional skills, technical and scientific advice, and probably most importantly, you bring accountability and safeguard the interests of communities. We all know that scientists around the world are speed up to find rapid and innovative solutions, to develop diagnostic tests as well as treatment and vaccines. However, our approach to tackling health threats and crises should not be a reactive measure. We should work on prevention. We need to work on identifying and mapping and reducing the drivers of risk. That is probably not a new motto, but I'm lucky because I do think that today is better heard. In this regard, it is great that the quadripartite be supported by a strong scientific and advisory group, such as OLEP, the One Health high-level expert panel, which has been launched in May last year, 2021, with the support of the governments of France and Germany. Its main objective is to provide the quadripartite partners with the best evidence-based scientific and policy advice to address the challenges raised at the animal-human environment interface. And I do think that in the coming days, you will hear about this panel and I invite you to join any discussion you could have with the experts. The quadripartite welcomes the first OLEP annual report, which includes the first key OLEP product, namely a comprehensive working definition of One Health, to which I invite you to refer. The report also highlights OLEP's priorities for the coming year, which will support us as quadripartite to move One Health from concept to practice. And on behalf of the OIE and its partner, and Susanna is there, let me take this opportunity to be on the stage to warmly thank the OLEP experts for their continued hard work. We look forward to continuing to work with their support to advance the implementation of the One Health approach at all levels. I say that civil society organizations also played a remarkable role during the pandemic by advocating for the protection and promotion of equal access to health. In the animal sector, that was the same. And I am proud to say that the veterinary services, which are part of the health workforce, also contributed in many countries to the global response to the pandemic by providing, for example, additional workforce for massive vaccination campaigns, or by providing additional PCR testing capacities in some specialized laboratories. And to facilitate this, our organization, the OIE, issued specific guidelines to be used by its members since the beginning of the pandemic. Dear participants, ladies and gentlemen, in front of you, I would like to highlight the collective efforts of the quadripartite to develop its One Health joint plan of action, which definitely is a milestone in our common quest to achieve our vision of a better and safer world. From this starting point, we have to move quickly to next steps, including informing our members, of course, and getting their insight of the viability and practicality of the plan. We also need to develop the implementation framework with concrete activities, clear role and responsibilities, and realistic timelines. Of course, partnerships with academia, private sector, civil society organizations are crucial to support the implementation and ensure adequate funding mechanisms for its execution. For several years, the OIE encouraged its members to be engaged in such partnerships. And we have also published guidelines and developed online training on this issue. Because we are convinced that is key for efficient veterinary services. Then, let us not forget that the One Health operationalization needs an appropriate alignment of the global plan with regional and country One Health policy. The commitment at global level must be empowered on the field through regional coordination mechanisms that are inclusive of all countries and stakeholders from both public and private sector. Global response, but implementation at local level. As first step was taken in last October when the tripartite UNEP and World Bank presented a paper at the request of the Italian G20 presidency, which perfectly highlighted the importance of One Health, as well as the need of sustainable and long-term political and financial commitment for One Health. And the following, the current G20 Indonesia presidency followed up and developed a joint health and finance task force agenda with objective to set up an improved mechanism to fund global health, which should include One Health as a strong pillar. That is very important. We must take advantage of and preserve this global political momentum, focusing on One Health, given that global challenges, and there are many, and priorities do change. And I encourage you, and particularly you, students and your people, because you are so numerous, I do think, in this room tonight, I encourage you to consider the quadripartite action plan as a blueprint for your next steps, for your next programs in advancing the One Health approach going forward. Before to conclude, ladies and gentlemen, I'd like to end my speech with a few words on the pandemic treaty you have heard about probably. We have to pay attention on the ongoing negotiations for a potential treaty on pandemic or international legal instrument, as this text will be instrumental for the future in terms of prevention, preparedness, and response. And the four key messages that our organization share during the public hearing are: first, the One Health approach should be the foundation for such a treaty, promoting the multisectorial and multidisciplinary approach. Second message, prevention. I will not further insist on how it's crucial to transform our relationship with the environment and to tackle health threats by protecting and restoring biodiversity and preventing the degradation of ecosystems. We need to move from response to prevention. To achieve prevention, we need to invest in more resilient health system, able to address the threats at this human-animal-environment interface, as well as in training the One Health workforce with adequate guidance for managing health threats thanks to this multisectorial approach. The OIE can play a major role, and I am convinced that we have this major role to be played, in particular by supporting national veterinary services, given our mandate at global level as a global authority setting international standards on One Health, including in animal health, on animal health, One Health, animal health, on animal health, including wildlife, as well as thanks to our capacity building program, the OIE PVS program. The third key message is science. The instrument or treaty should promote and facilitate science-based intervention and expand scientific inquiry into the environmental dimensions of disease spillover and spread, and develop joint early warning, surveillance, information management system, as well as data and evidence for timely decision-making. And the first and last message is financing, of course, because the instrument should include mechanisms to enable sustainable financing for the measures required under it, and further support the quadripartite collaboration to help countries implement the One Health approach. Ladies and gentlemen, we have all a role to play. In our respective domains, we have all a responsibility to make tomorrow safer and safer than today. The One Health approach is not just a concept. As I say, it must be a reality, it's not a fad. Together, we must achieve more swiftly and effectively and promote One Health as a guiding principle and a strong pillar of the future global health governance. Thank you for your attention.
We had that problem just earlier today. So for our final keynote, what better way to finish than by hearing with some words from Peter Maurer, President of the International Committee of the Red Cross. Welcome to the stage. You just skipped that part. Yeah, okay. You learned your lesson.
I have learned at school that the straight line is the shortest way between 2 points. Excellencies, colleagues, dear friends, from my side as well, I would like to commend Geneva University Hospital, the University of Geneva, and the Global Health Organizations for convening this forum, and of course also for inviting me to deliver some remarks. Where ICRC is and where we work and operate, we realize that we do so in an increasingly complex and fragile landscape. Armed conflict intersects with poverty and weak governance, with the destabilizing global trends such as climate change and COVID-19. It has been mentioned before by my colleagues. The impact of global power competition and instability remain prominent, as most recently illustrated in the context of Ukraine. We see people in situations of vulnerability without adequate health services, access to water and sanitation services, food insecurity, expanding from least developed countries into middle and high-income countries. In conflict-affected settings, COVID-19 pandemic put additional pressure on existing vulnerabilities, systemic and individual vulnerabilities. The way to recovery requires improving our collective capacity to respond more efficiently across artificial divides between sectors and to address direct and indirect health impacts, social determinants of health, and people's environments. I really appreciate the opportunity to share a couple of thoughts from the perspective of the ICRC with you today. Working at the front lines of conflict, the ICRC sees the devastating effects of armed conflict and violence on public health and health services around the world. Whether in Afghanistan, Ethiopia, Yemen, Syria, the Sahel, the Lake Chad, or in Ukraine, civilians suffer the immediate consequences of armed conflict. They are killed, injured, maimed. Health workers are threatened and under attack. Whole communities are cut off from vital medical services. The enduring effects of conflict on health are well documented, from physical harm to heavy tolls on individuals' mental health, who carry invisible scars of trauma, to the disruption of whole systems. In Yemen, only half of the health facilities are functioning, with limited capacities even though. More than 20 million Yemenis lack, therefore, access to basic health services. In 2021, in Tigray, Ethiopia, 80% of primary health care centers were not operational. Approximately 70% of the health personnel was not working anymore because of insecurity and access restrictions or fear. When armed conflict moves into cities, damage to essential infrastructure such as water, sanitation, and electricity have huge knock-on effects for the communities. As interdependent services, the failure of one can result in multiple services collapsing. In Syria, 10 years of conflict have destroyed critical infrastructure and brought the delivery of essential services close to the breaking point. Today, only 50% of water and sanitation systems are properly functioning with respective impact on health systems again. Most deaths during conflict are not directly caused by violence, but indirectly by the breakdown of systems. Too often also, health systems are intrinsically weak, so that even minor disruption from violence and conflict have disproportionate effects on vulnerability and vulnerable communities. Collapsed health systems may lead to serious breakdown of services for patients suffering from non-communicable diseases. Moreover, infectious diseases rip through communities where critical infrastructures have been destroyed and health systems are too much weakened to control them. Epidemics spread beyond the borders of war zones and are a concern for our global health. While some countries are envisaging a post-COVID period, we see at the same time the decline of health systems and the profound systemic inequities in access to basic health care. Global attention and policy focus has too often zoomed into the immediate COVID-19 response, or particularly on vaccination, sometimes neglecting the broader challenges that the pandemic brought to health system. COVID-19 recovery will only be successful if it is integrated within a broader health strategy. First, if it reflects the reality of people's health needs and priorities and builds on community engagement and trust. Secondly, if it is supported by investment in the long-term resilience of health systems, particularly health workforce and service delivery. And thirdly, if it reaches the large numbers of people in the last and on the last mile of health services. At ICRC, we estimate today that more than 60 million people are living under the control of non-state armed groups and are therefore excluded from national health systems. Dear colleagues, today's increased humanitarian needs far outweigh the available resources and capacities of the humanitarian sector to respond. As traditional approaches to aid will not yield sufficient solutions, an adequate and meaningful response to needs calls for more decisive collective efforts. Starting from the front lines and expanding to systems and planetary health, I suggest 3 pathways in which we can build on partnerships, technology, and innovation to bring forward enhanced impact. Firstly, we need greater protection for health systems, essential services, and health personnel. While today's conference brings together a community of medical practitioners, I repeat here what we have tirelessly reminded all states and armed groups for decades around the world. Respect for international humanitarian law is paramount in situations of armed conflict. The law protects hospitals, medical facilities, and medical personnel, who are our first and last line of defense. It ensures that essential health services reach everyone, the most vulnerable, those on the last mile I have mentioned. It protects civilians' essential infrastructure and the natural environment by preventing damage from occurring in the first place. International humanitarian law is a safeguard against public health crises. 10 years ago, the ICRC launched the Healthcare in Danger initiative. The community of concern and practice on this issue, representing now 12 medical and humanitarian organizations at global scale and 30 million healthcare professionals around the globe, has proven instrumental to influence and to share expertise, to advocate with political leadership for the protection of health services. Secondly, we need to strengthen health systems, starting from the community, and from health workers. People affected are also first responders. They are best placed to identify needs, design solutions that are relevant and accessible, enhancing the reach and the trust in health activities and the safety of frontline health workers. The Red Cross and Red Crescent movement builds on the proximity with communities. Their national societies volunteers are first aid responders and support primary health care, often so on the front lines of today's conflicts. Supporting health workforce contributes in strengthening resilient health systems. In Afghanistan, the ICRC is working with the Ministry of Public Health and Higher Education to support 33 hospitals and teaching hospitals, sustaining both services and staff capacity through running costs and salary payments, something we have never done before as a humanitarian operator. We are convinced of the value of this model for delivering through existing systems. It is a model to scale and enlarge to build resilient systems for the future. In Syria, ICRC is mobilizing partnerships around the rapidly deteriorating drinking water facilities that are, to quote, too big to fail. The humanitarian imperative and the development rationale are aligning to prevent the collapse of critical infrastructure causing disastrous consequences for millions. We see the partnering for impact is possible in conflict-affected settings. In South Sudan, ICRC is working with the World Bank to support 20 medical facilities, allowing 670,000 people to access essential healthcare between 2019 and 2021. In the Gaza Strip and in the DRC, we partner with pharmaceutical Roche and Find to enhance laboratory capacity and then scale up to more conflict-affected settings by developing operational guidelines and investment blueprint. In Africa, in 2022, the ICRC is launching surgical training hubs embedded in local hospitals in which ICRC and local staff benefit from traditional training methods as well as telemedicine and an online community of practice. Our physical rehabilitation programs for people with disabilities are at the core of ICRC's work in armed conflict, providing medical treatment as well as effective pathways to social integration through trainings and income-generating activities. These programs are integrating cutting-edge technology, such as the Agilis foot, which we can observe here also in the hallway, which we have developed with the technical universities in Switzerland. And new financing models, such as the Humanitarian Impact Bond, launched in 2017. The Humanitarian Impact Bond is the first result-based financing model in the humanitarian sector, set to attract private investment in an insecure environment. 3 rehabilitation centers were built, their staff trained to provide support to some 6,000 people with disability each and every year. If the project shows concrete impact, investors will get their money back and earn a return. We will see the report showing up in the middle of the year. We are also exploring other types of innovative financial instruments, such as blended finance, which will be prominently featured in the projects to be launched this year, 22. And I come to my third point. We need to address wider risks, which are a threat to global public health. For people suffering from armed conflict, climate change impacts all dimensions of their lives, including their health, yet they are at the least able to adapt. Long-term structural development deficiency are at the same time exposing vulnerabilities of health systems. As a humanitarian organization, do no harm is imperative. We are factoring climate risk and development failures into our programs, encompassing human, animal, and ecosystems' health, and strengthening people's ability to adapt to climate shocks and to overcome development gaps. We deliberately invest into health systems. We are reducing by 50% our own carbon footprint by 2025. We strengthen the implementation of IHL protecting the environment among states and parties to conflicts and build bridges to a human rights-based approach to health service delivery. Some of these commitments lie at the core of the Climate and Environmental Charter of Humanitarian Organizations, an initiative led by the Red Cross movement to galvanize humanitarian action in the face of the climate crisis, now signed by more than 220 humanitarian organizations. Channeling climate adaptation funds and development funds into fragile context to support health and other basic social services remains a major challenge today. Too often, political, institutional, bureaucratic, procedural aspects and a lack of capacity stand in the way of more substantial investments into the health sector in fragile contexts. Together with the World Bank again, we are convening a broad range of actors from development to humanitarian and academia to diagnose the challenges to direct climate action and finance to communities affected by violence and to developing solutions. While many issues can be improved by professional partnerships, by you here present tonight, the risk minimization and financial neglect of the most vulnerable context needs political leadership and more determined advocacy from health professionals. Dear colleagues, the Geneva Health Forum, as an expression of international Geneva, is a remarkable environment for bringing together different communities of practice, institutions, and disciplines. While confronted to global challenges, the momentum for us to work collectively and bring greater impact is here. Raising our voice to address inequities and inequalities is, in my view, a political and moral imperative for those coming together at this forum. Beyond fruitful exchanges and innovative solutions, I trust there is a clear signal coming out of this forum for more equitable health services for all and for political decisions which allow us to create an environment for such ambitious goals. I thank you.
So, ladies and gentlemen, there's obviously a lot to digest from the first day of the Geneva Health Forum. And I think if you want to leave the room with just one message, I think we should all recognize the platform that we have here. There's incredible capacity for dialogue and exchange and for us to create a healthier world so that maybe in 2 years' time when we gather for the Geneva Health Forum again, we can look back and be proud of the strides that we have taken in the meantime. Everyone is a little bit fidgety now, so I won't leave you too long sitting in the seats. Cocktail reception, most important details, will be found outside, so you can all gather there, mingle, handshake, network, whatever you like. And let's finish the day with a big round of applause for the first day of the Geneva Health Forum. Thank you so much.